dear BDS. My topic is on root caries. Introduction. Root caries is a soft progressive lesion that is found anywhere on the root surface that has lost its connective tissue attachment and is exposed to the oral environment. It occurs apical to the CJ. Most common reason for the occurrence is gingival recession, though other causes can also be present. With advanced age, there is more gingival recession in root surface leads to an increase in rate of root caries. Root caries can occur in the areas of abrasion, erosion and abstraction. Coming to etiology, the microflora responsible for root caries consists of Streptococcus mutans, Lactobacillus and Actinobacillus. Microorganisms metabolize sugar into organic acids. These acids then pass through the root surface and starts the process of demineralization. This process takes place at the pH of 6.4. The rate of demineralization of root occurs at higher pH and is much faster than that of enamel because of the root has much less mineral content than that of enamel. Then there are two types of root caries: primary root caries and secondary root caries. In primary root caries, it refers to new dental caries occurring in the absence of a restoration. Secondary root caries refer to the caries occurring adjacent to an existing restoration. Then clinical features: periodontal attachment losses exposing the root surface. There is no reported clinical symptoms. Pain may be present in advanced lesion. It may appear as irregular or round oval in shape, more common in males than females. Most commonly seen in mandibular molars, followed by premolar, canine and incisor. This order is reversed in maxillary arch. The buccal and interproximal surface are more susceptible than the palatal or lingual surface. Then caries activity in root surface are initial root caries, active progressive root caries, inactive root caries. Then treatment plan. Treatment plan for root caries depends on the following factors: clinical examination, size of the lesion, types, extent and site of the lesion, aesthetic requirement, physical and mental condition of patient. Root caries lesions are difficult to restore because of the location, which is usually subgingival. For proper restoration, sufficient access and isolation are needed. Proper access and isolation to treat root caries are very important, and if the lesion is on supragingival region, use of trabadam is required. If location of the lesion near the gingival margin or is subgingival, in that case cotton rolls and retraction cords can be used. If the lesion extends subgingivally and cannot be completely absorbed, even with the use of a retraction cord, a releasing insertion may be required for completing the restorative procedure. Root surface is cleaned with pumice to remove the plaque. Then the excavation of caries tooth tissue is done. Restoration was prepared. The margins and retention designs depending on the restorative material used. For example, when a tooth is to be restored with abnormal retention grooves are required occlusally and gingivally. For composites, beveling of the coronal margin of the preparation is required. There is protocol for a treatment of root caries that had put by Billings in 1985 called as following: grade 1 incipient, no surface defect, need remyelination therapy. Grade 2 shallow, surface defect less than 0.5 mm, need recontouring. Grade 3 cavitation, surface defect more than 0.5 mm, need filling. Grade 4 pulpal caries, pulp exposure, need osseity and filling. Restorative material used for root caries are direct filling gold, compomer, fluid containing resin composite, amalgam, resin composite, traditional glass ionomer, resin modified glass ionomer.